Ladies and gentlemen, esteemed colleagues, and distinguished healthcare professionals, it is a privilege to address you today on a subject of immense clinical and public health importance: the prostate gland, its disorders, and the dietary factors that silently influence its health. Despite significant advances in urology and oncology, prostate-related diseases remain a major cause of morbidity and mortality among men globally. As medical professionals, we are tasked not only with treating disease, but with understanding its etiology, identifying modifiable risk factors, and implementing preventive strategies. Today, I will focus on a seemingly mundane but highly impactful factor: diet. Specifically, 3 everyday foods that have been shown to negatively affect prostate health. While the prostate is small in size, it is highly susceptible to both systemic and local influences, particularly from the food men consume daily. My objective is to provide a comprehensive overview of the scientific evidence linking diet to prostate disease, discuss mechanisms of harm, and suggest actionable preventive strategies for clinicians to implement in their practice. Prostate anatomy and physiology. The prostate is a walnut-sized exocrine gland located inferior to the bladder and anterior to the rectum. It surrounds the urethra and contributes approximately 20–30% of seminal fluid volume. Structurally, the gland is divided into several zones: the peripheral zone, central zone, transitional zone, and anterior fibromuscular stroma. The peripheral zone, which comprises approximately 70% of the gland, is the most common site of prostate cancer development, whereas the transitional zone is the typical site of benign prostatic hyperplasia, BPH. Functionally, the prostate has 2 main roles: reproductive function, produces seminal fluid enriched with enzymes, citric acid, and zinc to support sperm viability and motility. Endocrine function, sensitive to androgenic hormones such as testosterone and dihydrotestosterone, DHT, which regulate growth, differentiation, and secretory activity. The gland's physiology is influenced by multiple systemic factors, including age, hormonal milieu, metabolic status, and dietary intake. Chronic exposure to dietary risk factors, particularly those high in saturated fat, processed compounds, and inflammatory agents, can induce structural and functional changes in prostatic tissue over time. Epidemiology of prostate disease. Globally, prostate cancer is the second most common cancer among men, with over 1.4 million new cases reported in 2020, according to the Global Cancer Observatory, GloboCan. Mortality rates vary significantly by region, with the highest incidence in North America, Northern Europe, and Australia, and lower rates observed in East Asia and Africa. This geographic variation underscores the role of environmental and lifestyle factors, particularly diet, in prostate disease risk. Benign prostatic hyperplasia affects a substantial proportion of men over 50. Epidemiological studies estimate that up to 50% of men in their 60s and 90% of men in their 70s, 80s experience some degree of BPH, manifesting clinically as lower urinary tract symptoms such as urinary frequency, nocturia, weak stream, and incomplete bladder emptying. Multiple large cohort studies have demonstrated associations between Western dietary patterns, characterized by high intake of red and processed meats, saturated fats, and refined carbohydrates, and increased prostate cancer incidence. Conversely, diets rich in vegetables, fruits, legumes, and plant-based proteins have been associated with lower rates of both BPH and prostate cancer. These observations highlight the prostate's sensitivity to dietary inputs and underscore the importance of preventive nutrition in clinical practice. Lifestyle and dietary context. While genetics and hormonal factors are non-modifiable, dietary intake is one of the most significant modifiable risk factors for prostate disease. A typical Western diet often contains high quantities of processed meats, full-fat dairy, and fried or fast foods. These foods contribute to systemic inflammation, oxidative stress, hormonal imbalance, and metabolic syndrome, all of which are recognized contributors to prostate hyperplasia and carcinogenesis. As clinicians, understanding the interplay between diet and prostate pathophysiology allows us to counsel patients effectively, implement early interventions, and ultimately reduce disease burden. Patient education must extend beyond simple recommendations to practical, actionable guidance that integrates into daily life. Conclusion of Part 1. In this introductory section, we have established the prostate's anatomical and physiological importance, the epidemiological trends of prostate disease, and the foundational link between diet and prostate health. The next sections will examine the three dietary culprits, processed meats, excessive dairy, and fried foods, in detail, exploring their mechanisms of harm, clinical evidence, and strategies for processed meats, including bacon, sausages, hot dogs, ham, and cured deli products, are among the most widely consumed animal products in Western diets. Their appeal lies in convenience, taste, and cultural preference, yet mounting evidence links these foods to significant health risks, particularly concerning the prostate gland. These risks are mediated through a combination of biochemical, inflammatory, and hormonal pathways. Epidemiological evidence. Large-scale epidemiological studies, including those conducted by the World Cancer Research Fund, WCRF, and the International Agency for Research on Cancer, IARC, classify processed meats as Group 1 carcinogens. Multiple cohort studies have demonstrated that men who consume more than 50 grams of processed meat per day have a significantly higher risk of developing prostate cancer compared to those with minimal intake. Study. Example 1. The European Prospective Investigation into Cancer and Nutrition, EPIC, cohort reported a 20-30% increased risk of prostate cancer among men with high processed meat consumption over a 10-year follow-up. Study Example 2. A meta-analysis encompassing 18 studies confirmed a dose-response relationship, showing that each additional daily 50-gram portion of processed meat increases prostate cancer risk by approximately 12%. Mechanisms of harm: saturated fat-induced inflammation. Processed meats are rich in saturated fats, which contribute to chronic low-grade inflammation. Saturated fats activate toll-like receptor 4, TLR4 pathways in immune cells, increasing pro-inflammatory cytokines such as interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-A. Chronic inflammation in the prostate microenvironment promotes hyperplasia, disrupts normal epithelial differentiation, and can initiate carcinogenesis. Nitrosamines and chemical carcinogens, preservatives such as nitrates and nitrites, commonly used in processed meats, can convert into nitrosamines in the gastrointestinal tract. Nitrosamines are potent mutagens that alkylate DNA bases, leading to point mutations and chromosomal instability in prostatic epithelial cells. Animal studies have demonstrated that exposure to dietary nitrosamines can induce prostate neoplasia, highlighting a plausible mechanistic link to human disease. Oxidative stress. Excessive consumption of processed meats increases reactive oxygen species, ROS, generation. ROS damage DNA, proteins, and lipids within prostate cells. The oxidative stress response triggers repair mechanisms. However, repeated or chronic exposure can overwhelm repair capacity, leading to mutagenesis and tumor initiation. Clinical observations. In clinical practice, we often encounter patients with high processed meat intake presenting with elevated PSA levels, early BPH symptoms, or histopathological evidence of prostatic intraepithelial neoplasia, PIN. Case Study 1. A 58-year-old male with a 20-year history of daily bacon and sausage consumption reported nocturia and urinary hesitancy. PSA was elevated at 7.2 nmol. Dietary modification, combined with pharmacologic therapy, led to symptomatic improvement and stabilization of PSA over 6 months. Case Study 2. A 62-year-old patient undergoing biopsy for elevated PSA was found to have early-stage prostate adenocarcinoma. Retrospective dietary assessment revealed frequent consumption of cured and smoked meats. This case underscores the cumulative impact of long-term dietary patterns on prostate pathology. Preventive strategies and clinical guidance. Dietary counseling clinicians should educate patients on the risks associated with processed meat consumption. Encourage substitution with lean meats such as skinless poultry, fish, or plant-based proteins like legumes and tofu. Cooking methods. Where animal protein is consumed, recommend healthier cooking methods such as steaming, boiling, or baking instead of smoking, curing, or frying, which increase the formation of heterocyclic amines, HCAs, and polycyclic aromatic hydrocarbons, PAHs, both implicated in carcinogenesis. Frequency and portion control. Advise limiting processed meat consumption to occasional or very small portions. Emphasize moderation rather than complete elimination to enhance patient adherence. Integration into clinical practice. Incorporating dietary assessment into routine consultations is essential. Use food frequency questionnaires, FFQs, and 24-hour dietary recalls to quantify processed meat intake. For patients with high risk due to family history, elevated PSA, or early prostate pathology, dietary modification becomes a cornerstone of preventive care alongside pharmacologic interventions and lifestyle counseling. Conclusion of Part 2. Processed meats represent a clear and modifiable dietary risk factor for prostate disease. Their influence is mediated through inflammatory pathways, oxidative stress, and chemical carcinogens. By recognizing the impact of these foods, clinicians can implement targeted dietary interventions, reduce cumulative risk, and improve long-term prostate health outcomes. Prevention. To dairy products and prostate health. Dairy products, including whole milk, cheese, cream, and butter, are widely consumed globally and have traditionally been associated with bone health and strength. However, emerging evidence suggests that excessive consumption of high-fat dairy can have unintended consequences on prostate health, contributing to both benign prostatic hyperplasia, BPH, and prostate cancer. The mechanisms by which dairy affects prostate health are multifactorial, involving hormonal regulation, inflammation, and metabolic pathways. As clinicians, understanding these mechanisms enables us to provide evidence-based dietary guidance to patients. Epidemiological evidence. Numerous cohort and case control studies have evaluated the relationship between dairy intake and prostate disease risk. Study. Example 1. A prospective analysis of the Health Professionals Follow-Up Study, HPFS, involving over 47,000 men, demonstrated that high consumption of whole milk and full-fat dairy was associated with a significantly increased risk of advanced prostate cancer. Men consuming more than 2 to 3 servings of high-fat dairy daily exhibited a 30% higher risk compared to those with minimal intake. Study Example 2. Meta-analyses have consistently shown a dose-dependent relationship between dairy intake and prostate cancer incidence, High calcium intake from dairy correlates with increased prostate cancer risk, likely due to suppression of 1,25-dihydroxyvitamin D3, a hormone known to inhibit proliferation and induce apoptosis in prostatic epithelial cells. Interestingly, studies also indicate that low-fat or fermented dairy products, such as yogurt, may have a neutral or slightly protective effect, likely due to probiotic content and lower saturated fat levels. Mechanisms of harm hormonal effects. Excessive dairy intake can alter circulating hormone levels, particularly androgens and insulin-like growth factor 1, IGF-1. Elevated IGF-1 promotes mitogenic and anti-apoptotic activity in prostate cells, contributing to hyperplasia and carcinogenesis. Saturated fats in dairy further exacerbate androgen-driven prostatic growth. Calcium overload. High calcium intake can suppress 1,25-dihydroxyvitamin D3 synthesis, a vitamin D metabolite with anti-proliferative and pro-apoptotic effects in prostate tissue. The reduced activity of vitamin D impairs regulation of cell cycle and differentiation, increasing the likelihood of neoplastic transformation. Inflammatory pathways. Saturated fats in dairy products enhance systemic and local inflammation. Elevated pro-inflammatory cytokines, such as IL-6 and TNF-A, contribute to stromal proliferation, epithelial dysplasia, and increased susceptibility to tumorigenesis. Oxidative stress. High-fat dairy can induce oxidative stress through lipid peroxidation, increasing reactive oxygen species that damage DNA and cellular structures in the prostate. Chronic oxidative stress is a known facilitator of mutagenesis and cancer progression. Clinical observations. Clinicians frequently encounter patients whose high-fat dairy consumption aligns with early signs of prostate disease. Case Study 1. A 60-year-old male presented with mild urinary urgency and elevated PSA, 6.8 ml. Dietary history revealed daily consumption of 3 to 4 glasses of whole milk and multiple servings of cheese. Intervention included substitution with low-fat milk and plant-based alternatives, resulting in stabilization of PSA and improved urinary symptoms over a 12-month follow-up. Case Study 2. A 65-year-old male with early-stage prostate adenocarcinoma reported habitual consumption of high-fat dairy since adolescence. After dietary modification and medical management, progression was slow, and inflammatory markers decreased significantly. These clinical observations underscore the cumulative effect of long-term dairy consumption and the potential benefit of dietary intervention. Preventive strategies and clinical guidance moderation and substitution. Patients should be advised to limit high-fat dairy consumption. Low-fat options and plant-based alternatives such as almond, soy, or oat milk can provide adequate nutrition without the harmful effects associated with saturated fats. Incorporate anti-inflammatory foods. Encourage inclusion of foods rich in omega-3 fatty acids, polyphenols, and flavonoids to counteract pro-inflammatory effects. Leafy greens, cruciferous vegetables, and berries can provide protective bioactive compounds. Education on portion sizes. Provide clear guidance on serving sizes and frequency. For example, limiting full-fat dairy to 1 to 2 servings per week can mitigate risk while maintaining adequate nutrient intake. Integrate into comprehensive lifestyle plan. Dairy modification should be part of a holistic strategy, including physical activity, weight management, and routine prostate screening. Multidisciplinary counseling involving dietitians, exercise specialists, and clinicians enhances adherence and outcomes. Mechanistic insights for professional discussion. IGF-1 signaling Elevated dairy-derived IGF-1 enhances PI3K ACT signaling in prostate epithelial cells, promoting survival and proliferation. Vitamin D pathway suppression. Calcium overload downregulates 1A hydroxylase, reducing active vitamin D synthesis and impairing cell cycle regulation. Cytokine modulation. Saturated fats increase NF-κB activity, leading to chronic inflammation and microenvironmental changes conducive to hyperplasia and tumorigenesis. Understanding these pathways allows clinicians to explain the rationale for dietary intervention scientifically and to justify recommendations to high-risk patients. Integration into clinical practice. Dietary assessment. Utilize food frequency questionnaires to quantify dairy intake. Patient counseling. Explain the mechanistic rationale for risk reduction in accessible terms. Longitudinal monitoring. Track PSA, inflammatory markers, and clinical symptoms in patients implementing dietary changes. Case-based education. Use anonymized patient examples to reinforce the clinical significance of dairy reduction. Conclusion of Part 3. Excessive high-fat dairy consumption is a significant and modifiable risk factor for prostate disease. Its effects are mediated through hormonal disruption, calcium overload, inflammation, and oxidative stress. Clinicians can reduce patient risk through education, dietary modification, and integration into broader preventive strategies. By addressing dairy intake as part of a comprehensive lifestyle intervention, healthcare professionals can improve long-term prostate outcomes, slow disease progression, and empower patients to take an active role in their health. To fried and fast foods. Fried and fast foods, including French fries, fried chicken, commercially prepared snacks, and fast food meals, are a ubiquitous component of modern diets. Their popularity stems from convenience, taste, and affordability. However, evidence increasingly links frequent consumption of these foods to negative prostate outcomes, including benign prostatic hyperplasia, BPH, and prostate cancer. These foods are typically high in trans fats, advanced glycation end products, AGEs, acrylamides, and refined carbohydrates, all of which contribute to systemic inflammation, oxidative stress, hormonal dysregulation, and metabolic syndrome, factors implicated in prostate disease. Epidemiological evidence. Several large cohort and case control studies demonstrate the association between fried fast food consumption and prostate disease risk. Study. Example 1. The NIH AARP Diet and Health Study followed over 500,000 men for 10 years and found that high consumption of fried foods was associated with a 15 to 25% increased risk of aggressive prostate cancer. Study Example 2. A meta-analysis of 12 studies confirmed that diets high in trans fats and fried foods correlate with higher PSA levels, increased incidence of BPH, and worse prostate cancer prognosis. Populations consuming predominantly westernized fast food diets exhibit higher prostate cancer mortality rates compared to those consuming traditional plant-based diets, supporting the role of diet in disease progression. Mechanisms of harm. Trans fat-induced inflammation. Trans fats, abundant in fried foods and commercial baked products, activate pro-inflammatory pathways via toll-like receptor 4, TLR4, and nuclear factor kappa B, NF-κB. Chronic inflammation promotes hyperplasia, disrupts tissue homeostasis, and contributes to tumorigenesis. Advanced glycation end products, AGEs. High-heat cooking and frying produce AGEs, which bind to receptors, RAGE, on prostate epithelial cells, activating oxidative stress pathways. This leads to DNA damage, cellular senescence, and increased cancer susceptibility. Oxidative stress fried foods generate free radicals and reactive oxygen species, ROS. Persistent oxidative stress damages DNA, lipids, and proteins, contributing to genomic instability in prostate cells. Metabolic effects. Frequent consumption of fried and fast foods promotes obesity, insulin resistance, and hyperlipidemia. Metabolic syndrome increases circulating insulin, IGF-1, and inflammatory cytokines, all of which stimulate prostatic hyperplasia and carcinogenesis. Clinical observations. Case Study 1. A 59-year-old male with daily consumption of fried fast foods reported nocturia and urinary hesitancy. PSA was mildly elevated at 6.5 ng/ml. Nutritional counseling and transition to grilled meals led to symptomatic improvement over 6 months, with reduced inflammatory markers. Case Study 2. A 63-year-old patient undergoing radical prostatectomy for early-stage adenocarcinoma had a history of frequent fried food consumption since adolescence. Post-operative counseling emphasized diet modification, and follow-up showed stabilization of PSA and improved metabolic markers. These examples highlight the cumulative impact of long-term dietary habits on prostate health and underscore the importance of early dietary intervention. Preventive strategies and clinical guidance. Dietary counseling advise patients to limit fried and fast foods to occasional consumption. Emphasize alternatives such as steaming, baking, grilling, and stir-frying with minimal oil. Healthy fats. Encourage use of mono and polyunsaturated fats, such as olive oil or avocado oil, which do not produce harmful trans fats or AGEs when used appropriately. Portion, control, and frequency. Educate patients about the cumulative effect of repeated exposure to high-fat, fried foods. Limit intake to once a week or less for at-risk individuals. Integration with lifestyle interventions. Combine dietary changes with regular physical activity, weight management, and metabolic monitoring. Physical exercise improves insulin sensitivity, reduces systemic inflammation, and mitigates the negative impact of high-fat diets on the prostate. Mechanistic insights for professional discussion. NF-kB activation. Trans fats and AGEs trigger chronic inflammation in the prostate via NF-kB, promoting stromal proliferation and epithelial dysplasia. Oxidative DNA damage. ROS generated from fried foods cause guanine oxidation and double-strand breaks, increasing mutation rates. Metabolic hormonal impact. Insulin and IGF-1 pathways, elevated by obesity and high-fat diets, enhance mitogenic signaling in prostatic tissue. These mechanistic insights allow clinicians to explain the underlying science behind dietary recommendations and justify behavioral modifications for at-risk patients. Integration into clinical practice. Dietary assessment tools. Utilize food frequency questionnaires to quantify fried and fast food intake. Patient education. Explain the biochemical and clinical rationale for reducing these foods. Monitoring. Track PSA levels, metabolic parameters, and urinary symptoms in patients implementing dietary changes. Interdisciplinary collaboration. Work with dietitians and lifestyle coaches to optimize adherence and long-term outcomes. Conclusion of Part 4. Fried and fast foods are a modifiable risk factor for prostate disease. Their negative impact is mediated through trans fats, oxidative stress, inflammation, and metabolic dysregulation. By providing evidence-based dietary guidance, clinicians can reduce the burden of prostate disease, slow progression, and enhance patient quality of life.